Well, good afternoon, everybody. I want to thank you for being here today. Obviously, the legislature just a little while ago completed a special session that commenced immediately upon the conclusion of the rather uneventful regular session, which obviously had been disrupted due to COVID-19. Obviously, there were some important measures that were passed during the special session. And there are a number of bills that we're still going to have to receive the final versions because conference committee reports were actually adopted today and within the last couple of hours. And so it's not clear to us exactly what's in all of those bills. But I do want to express my appreciation for the legislature and the leadership for working through the session. It's been extraordinarily difficult because of COVID-19. And obviously tomorrow marks the first day of the next fiscal year. And so we're going to get the supplemental budget tonight that I do plan to sign so that we can do what we need to do as soon as possible to take care of those expenditures in the current year. And then we'll be taking a look at other bills moving forward. The budget that was passed obviously is not the budget that we envisioned whenever I gave my opening address to the legislature back at the start of the regular session. At that time, the economy was doing extremely well. COVID-19 had not yet hit Louisiana in any real way and so forth. And obviously revenue was much better than it is currently. We had worked over the last 4 years to break that cycle that had plagued Louisiana for so long with perpetual deficits and cuts and mid-year cuts and expenditures of one-time money and all of that sort of stuff. And because of the REC forecast, we're actually $900 million in state general fund below where we needed to be. And thank goodness for the CARES Act funding that was made available to us, and I want to thank Congress for that, and particularly our congressional delegation, because it made a tremendous difference. And to be here today because of the CARES Act with a workable budget, one that's not ideal, there are still cuts, principally to higher education and health care, which, as you know, those are the go-to parts of the budget anytime you have to find state general fund in relatively large amounts, and they were again this year. But the CARES Act funding allowed us to pass what I believe is a workable budget, and one that in many, many respects appears to be, and we don't have the final re-engrossed version yet, but appears to be very consistent with the document that we gave to the legislature in terms of outlining the budget. I was disappointed with the way the legislature chose to handle the pay raise issue for classified employees. Obviously, our state employees work extremely hard to keep the government open and functioning, especially during the COVID-19 pandemic. It's regrettable that the legislature didn't see fit to provide them with a modest raise this year that the law says they were entitled to, especially since the funding is available. So we'll be taking a look at that. Other measures passed this special session did specifically focus on the hardworking people of Louisiana, particularly House Bill 70 by Representative Sam Jenkins. I want to thank him for his leadership on this issue, but also all the members of the House and the Senate who unanimously voted to provide $50 million in funding for hazard payments for frontline workers. These are payments of $250 to these frontline workers who've been working so hard through the COVID-19 pandemic. They include healthcare workers, first responders, grocery store employees, among others. And I know that Representative Jenkins and many others, and I as well, thought it was extremely important to acknowledge these essential workers at this time. And obviously you can't put a price tag on how these individuals are helping to keep us healthy, keep us fed, keep our communities functioning, and so forth. But I am happy the legislators were able to work together to pass this gesture of gratitude. As I mentioned, it's $50 million in Globo, but it's $25 million came from the local portion of the CARES Act funding, and $25 million came from that part that had previously been carved out for the business program with respect to CARES Act funding. I also want to commend Senator Cleo Fields for authoring Senate Concurrent Resolution 7, and Representative Ted James, who had a similar measure in the House. This resolution by Senator Fields will create a 25-member task force to study police practices across the state of Louisiana. I think it's part of a larger, very critical discussion about policing, but also about race and race relations and justice and what that should look like going forward. And by the way, these conversations are taking place all across the country in state houses around the nation, and certainly it's time that we do it here. They're also taking places around dinner tables in houses all around the state of Louisiana and around the country. I want to thank the members of the legislature who this year took the time to speak about very raw and painful emotional topics in the debate of these measures, and to raise the issue of racial injustice again. I believe we can do better. I believe we owe it to our kids and our grandkids to make sure that we do better. This task force is an important step. And while my signature isn't required for a resolution such as the one that created the task force, I did support this measure, and I thought it was important for individuals out around the state of Louisiana to know that I support it. And I look forward to the work that they're going to do. Because this is not just about discussions, this is not just about studying, this is about real change, and we're going to see that. Perhaps the most talked about bills of the session, and it carried over from the regular session, had to deal with tort reform. And I know we ended up with a bill that was concurred in today by both the House and the Senate. It was House Bill 57 by Speaker Sexsnyder, which obviously, to my mind, is a much more balanced approach than the other bills that were floating around this year and this session, and the one that came out of last session. I think it represents a real compromise. And so I want to thank the Speaker and Representative Stefanski and the other individuals on the House side who worked so hard on that particular measure. And I want to thank the folks in the Senate as well who worked on it. And I know that there were a number of members who did that, but Chairman Peacock of Jude being one of those, Senator Jay Luno, and others. Even though there's a lot more that we hope to accomplish, I do want to thank the legislators who worked hard to get some important measures passed this session, again, under very unprecedented circumstances. And I want to thank the Speaker for his leadership, and the President as well for presiding over their bodies during these last two sessions. Before I take your questions about the session, I do want to point out that we will have a full COVID-19 media briefing tomorrow at 2:30 here in the press room, and that we did add 1,014 new cases today, and sadly 22 new deaths. We had a very large number of tests, however, that we reported today, over 20,000. And so the positivity number actually went down today, which is a good thing. But we continue to be very concerned about the hospitalization numbers. We've totally given up all the gains we had made in June with respect to hospitalized COVID-19 patients. So we have a lot of work to do. 27% of the new cases reported today were from people aged 18 to 29. And that's really driving the numbers. That's the biggest driver here in Louisiana and in many places around the country. So I'll leave the people of Louisiana today with the message that they've heard before. Obviously, COVID-19 is not yet done with Louisiana, just because you think you're done with it. So wear a mask, wash your hands frequently, stay home if you're sick, keep good physical distance from others, not part of your immediate households when you're out in public. And if we will do these things, then our numbers are going to improve, and we're all going to benefit from that. So we'll now take a few questions. Yes, sir.
Governor, lawmakers passed tax break bills that'll cost more than $200 million over the next 5 years. This year it's going to be paid for with unclaimed property money. But I guess, are you worried about the future impact those are going to have on the budget, especially next year if the economy is not fully recovered?
Well, you always worry about those things, and quite frankly, some adjustments were made in some conference committee reports, and we're not entirely clear what the note will be, whether it's next year or the subsequent years. And when I say the note, I'm talking about the cost. And so those are some of the things that we're going to be reviewing over the next several days. But you always have to worry about that because obviously we did an awful lot of work over the first 4 years to restore sanity to the fiscal situation in the state of Louisiana. And you don't want to go back to the days that we just came out of. And you know, you can appreciate the fact that people in the legislature want to give some help to specific businesses and so forth, but at the same time, they have to understand that those are tax expenditures. It's spending by a different method, and we're required to have a balanced budget, and so it all has to be put into balance and make sure that we're doing right. So, am I concerned? I am. I'm not going to make any specific comments today on any one of those bills, but we are going to be looking at all of them. Any other questions? Yes, ma'am.
Oh, hi. I wanted to ask a question about coronavirus, actually. I'm sorry, it's not about the session. Are you thinking of, are you going to take another look at requiring masks? I know that since you last spoke about that, there have been a lot of jurisdictions now that are requiring masks.
Yeah, obviously we're going to look at everything that we might need to do to get control of the numbers as best we can to get off the trajectory we're on. Again, the thing you cannot let happen is you cannot lose the capacity in the hospitals to deliver critical care. We're nowhere close to that today. You know, at the height of the numbers, we had over 2,000 people in the hospitals across the state with COVID-19. We're nowhere near that, but we're going to be looking at a number of measures. We do know that masks are important. There's a CDC recommendation. We mandate their usage by employees, and when they're going to be engaging with customers and so forth. And we know that there are some political subdivisions here in Louisiana that are starting to require their usage. I will tell you that the guidance that we're receiving coming from the White House Coronavirus Task Force is asking that we consider mandatory mask usage not necessarily statewide, but in political subdivisions that meet certain criteria as it relates to case growth, positivity, a factor of tests, and that sort of thing. So what we'll be looking at it. You know, at the end of the day, we need people to do a better job of wearing their masks. It's part of every statement that we make on this. It is a CDC recommendation. I think you're starting to see folks like Leader McConnell in the Senate and Dr. Fauci and Dr. Birx speak about this. In our call yesterday, the Vice President talked about it, the importance of doing it. And we do need more compliance. I am not sure that a statewide mandate would produce the level of compliance that we need, and that there would be issues related to the enforcement of such a mandate. But I do encourage everybody to do it and remind people that it is, in the era of COVID-19, it is the same thing as being a good neighbor, and understanding that if you wait until you feel sick or know that you have COVID-19 before you wear a mask, that is completely illogical. because we know that a big percentage of people with COVID-19, even though they can spread the disease, they're not going to have symptoms. And people who develop symptoms will have started spreading the disease 48 hours before the onset of the symptoms. So we need people to wear their masks. That's one of the ways we keep the numbers from spiking further than is necessary. Somebody, yes, ma'am.
So based on your comments about the tort reform bill, is that an indication that you intend to sign that bill? And then the other question is on the school limitation of liability bill. Some issues were raised by Bessie in the Department of Education in the final version, and I'm wondering if you've taken a position on that.
Yeah, we've got to take a look at the bill, and that was, I think, the last thing to come off the House floor, and so I haven't been able to look at the final language. That's Representative Mincy's bill, and I know, if I'm not mistaken, it was just a slight majority that actually passed the final version of that off the House floor. So we're going to be taking a look at that. I just can't offer a comment on that now. With respect to the House Bill 57 by the Speaker, I do intend to sign the bill. Yes?
Governor, you returned the capital outlay bill with no line item vetoes. I'm wondering why that was. Was that part of a deal with Republican lawmakers, or were you worried about them overriding your line item vetoes?
It was neither. There was no deal, and I don't worry about them overriding my veto.
Why didn't you return it? It's pretty standard practice, I feel like, for a governor to line items out of the capital outlay budget. Why didn't you do that this time?
Well, it wasn't necessary because we have just a very slight amount of that it's out of balance, and that will be fixed by addressing those projects that were actually added late that aren't actually going to make it through. So it just wasn't necessary to do that. The instrument was in balance, and there was no deal about any one project or all the projects, and certainly not a concern about a veto being overridden. Yes.
With the new term and the change in leadership in the House and Senate, can you talk a little bit about whether it was more difficult or just different to negotiate with the House and Senate since they were showing a more united front in their leadership?
No, it wasn't. It wasn't any more difficult, quite frankly. Yeah, I think there are always going to be issues, and you have to work through them. But so long as leadership is committed to working through them, we'll get that done. And in many ways, it actually can be easier, so that rather than everything being a triangular negotiation, it can be bilateral on more issues, and it actually can be easier. And I think in some respects we saw that this year. What made the two sessions this year harder than anything else was just the COVID-19, the public health emergency. And I will tell you that from my perspective, the legislative process suffered a little bit because of the limited interaction with the public, limited interaction among lawmakers with one another in social settings after hours and that sort of thing. But I actually felt like the communications between myself and my staff and the Speaker and the President and other legislators was actually really good. Again, not that we agreed on everything, but we're not supposed to. That's not the way this is supposed to work, and I guess that's especially true with me being a Democrat and them being Republicans. But I feel good about the effort overall. Yes, sir.
Governor, do you think this session lived up to its billing as it was ostensibly called as a coronavirus recovery session? Do you think the laws that were passed helped the people of Louisiana recover from the coronavirus?
Yeah. Because we appropriated the dollars that Congress sent back to Louisiana in the CARES Act that obviously is going to help. We've got a program up and running where we're reimbursing expenditures by local government, and the commissioner and the folks at GoSEP are doing a great job with that program. There's another program that created to aid small businesses. There's another program that we just talked about, Representative Sam Jenkins' bill, that deals with frontline workers. There were some immunity provisions that were enacted, especially in the first session, with I think just about unanimous votes in both bodies. So all of those things I think were very helpful. And it's my hope and my expectation that Congress, and I know there was some mention by Senator McConnell today, that late in July they will take up a phase 4, and there will be additional assistance that comes to Louisiana. And I think that when we get into the October timeframe, it'll be time to have REC meet, look at revenue, look at the economy, see where we are relative to their forecast, what revisions, if any, have to be made, but also take into account whatever additional assistance might be available at that time from Congress, and then move forward. And if we have to do those things, then the reason I mention that is we could be coming back in October, and I think most people expect that we will, in order to have a special session of the legislature. But between now and then, we have a budget, and it's a reasonable budget. It's workable. It's not ideal. It's not what we wanted at the outset of the regular session. But yeah, there was a lot of good work that was done. But we continue to have a lot of work to do. Obviously, we still work, for example, with the Resiliency Commission that we created. 15 task forces operating under that. Every sector of our economy is represented because the public health emergency is going to be here tomorrow, and it's going to be here the day after tomorrow, and working with those individuals in order to make sure that we reopen our economy as we were able to do so safely, put more people back to work is incredibly important, and getting them engaged in order to make sure that we do get more compliance with existing restrictions and with the mitigation measures. And all of those sectors of our economy are going to be very, very important. So we're going to continue to work with them. And we don't know, we're in a new normal, and we don't know what the end date of that's going to be. And so I would tell you that this task force that we've created, this commission that we created is going to be incredibly important going forward as well. Yes, sir. Yeah. Yeah, well, we are. And first of all, you got to understand that the way this works is you see the data, you get concerned, and then you entertain a whole range of options, but it doesn't mean that you're close to pulling the trigger on any one of them. But obviously we are looking, and because quite frankly, it's not just the 18 to 29-year-old group, although as that entire group is more of a problem today than was the case a few weeks ago, but it's the 18 to 21-year-old part of that. And when you have a college town like Baton Rouge, where you have the Southern University and LSU, you've got BRCC, I will tell you that the growth in cases, 18 to 21 years old, right now, it looks like a near vertical line. And so any responsible governor or mayor or leader of any kind has to look at that with some concern, and not principally because of the health of the young people, but because of the fact that the young people are getting the disease and they are contagious and they are spreading it to people who are vulnerable. But that is not to say that everyone who is younger is not going to suffer a significant impact because of the disease, and because some individuals die, others will have organ damage and that sort of stuff that they're going to have to live with for a long time. But we are looking at a range of measures, and when we have an announcement on those things, we will certainly let you know. And by the way, we're not alone in this. If you look at the news, I think last night there were up to 16 states that paused their reopening. I think we may have been the first one, but I think the fact that you've got 16 states that are now pausing, and probably more tonight, it just reaffirms the correctness of the decision that we made here. I will tell you that given our numbers recently, especially in terms of test positivity, we have received renewed attention from the White House Coronavirus Task Force specific to Louisiana. I had a conversation with Dr. Birx earlier this afternoon, talking specifically about what we can do here in Louisiana to try to get control of these numbers again. And their concern is the same as ours. is that if you don't turn these numbers around at some point, you know that you threaten your ability to deliver health care, and we don't want to get anywhere near that point. And so it all has to do with more testing, a better testing strategy, more compliance with restrictions and mitigation measures, and with more effective contact tracing. It's all of that is really important, and that's going to be the subject matter of our press conference tomorrow at 2:30, when we're going to have a lot more information for you about all of these things. Now, I think there was somebody, yes, ma'am, and this will be the last question.
Back in March, lawmakers started a petition to end your COVID-19 emergency order, and just recently it started to pick up more traction. What are your thoughts?
Well, first of all, I don't know how much more traction it's gotten.
The last I checked was around 40.
Yeah. Well, it would be a tragic mistake. It would be irresponsible beyond anything that you can imagine, that Louisiana, with the numbers that we have, would be the only state in the nation without a public health emergency. And all of that it allows the state to do in terms of directing resources and testing and in making available resources from the federal government. But if we don't have a public health emergency today, given the test numbers that the case growth that we're seeing, given the hospitalizations we're seeing, the positivity rate increasing every single day, then I suspect no state does. And so it would be incredibly irresponsible for legislators to do that. And quite frankly, I don't believe that they will be successful. The other thing they say is, well, we want to make sure that we're opening our economy faster. Well, what criteria do they want to use? Do they want to use the criteria set forth by President Trump and the White House Coronavirus Task Force? Because that's what we're doing. There are 3 gating criteria to look at. We didn't meet any of them. None. And they don't argue that we did. They're substituting their opinions for the president's and the Coronavirus Task Force, for the CDC and so forth. And it's just grossly irresponsible. And for that reason, I don't believe that it's going to happen, and it would certainly be a sad day for Louisiana if it did. So thank y'all very much. Obviously, we will review bills over the coming days. I will sign the supplemental appropriations bill. Hopefully, it's ready now. And then we'll be back here at 2:30 tomorrow. I'll take your questions on COVID-19 and follow-up questions about the session as well. Well, really anything you want to ask. So we'll see you tomorrow. Thank you.